All right, let's jump right in. We're going to spend the next few minutes breaking down a condition that affects millions of people around the world, diabetes. My goal here is to cut through all the noise and give you a really clear, up-to-date look at what it is, how we're treating it now, and some of the incredible breakthroughs that are changing the entire game.
So just for a second, I want you to imagine your body is like a high-performance engine. It needs fuel to run, right? For us, that fuel is sugar, also known as glucose. But what if the system for getting that fuel into your cells, where you actually need it for energy, just completely breaks down? That question right there is the absolute heart of what diabetes is all about.
So here's the simplest way to think about it. Diabetes is basically a problem with a hormone called insulin. Let's use an analogy we'll come back to. Think of insulin as the key that unlocks your body's cells, letting all that sugar in to be used as fuel. If you don't have enough keys, or maybe the keys you have don't work right, then that fuel is just stuck outside. And when that sugar can't get into the cells, well, it has to go somewhere, so it just stays in the bloodstream. And that's when you get high blood sugar, or what doctors call hyperglycemia. And that one single issue is the core problem that connects every single type of diabetes.
Okay, so while the end problem, that high blood sugar, is the same, the reason it's happening can be totally different. And this brings us to the two main highways of diabetes, type 1 and type 2. Let's dig into what makes them so distinct.
This table lays it all out pretty clearly. Over on the type 1 side, the root issue is what we call an autoimmune reaction. Basically, the body's own immune system gets confused and attacks the very cells that make insulin. This usually kicks off in childhood, and it means that taking insulin isn't optional, it's essential. Now, type 2, that's a different story. The body is still making insulin, but the cells just aren't listening to it anymore. We call that insulin resistance. It's usually a mix of genetics and lifestyle factors, and it typically shows up in adulthood, though we're seeing it in younger people now too.
Let's go back to our key analogy for a second. For type 1, I want you to picture the body's immune system as a demolition crew that mistakenly tears down the factory that makes the insulin keys, your pancreas. The result is simple, and it's absolute. No factory means no keys, and no keys means sugar is locked out of the cells. So what about type 2? Well, the key factory is still open for business. In fact, it's often working overtime, pumping out tons of insulin keys. The real problem is with the locks on the cells. They've become stubborn and resistant, almost like they're rusted over. The keys just don't fit right anymore, so the sugar still has a really hard time getting inside. Now, all of this might sound a little overwhelming, but here's where the story gets really, really helpful. The way we treat diabetes today has been completely revolutionized. So let's open up the modern toolkit, because it is packed with some truly game-changing stuff. Just look at the evolution for type 1. I mean, it's incredible. We went from the standard of multiple injections every single day to insulin pumps that deliver a steady drip of insulin around the clock, all the way to what we have now, these smart, automated systems. These things are amazing. They actually talk to a glucose monitor and adjust the insulin dose automatically. It's like having an artificial pancreas. It's just a massive leap forward for quality of life. Okay, so for type 2, the approach starts in a different place, but it is just as powerful. Before we even get to medications, the absolute foundation of treatment is lifestyle. Things like healthy weight management, diet, and regular exercise can fundamentally change how the body responds to its own insulin. It's like you're actively de-rusting those locks on your cells.
And then we get to the medications for type 2. And this is where things get really exciting. We now have entire classes of drugs that do so much more than just lower blood sugar. SGLT2 inhibitors, they protect your heart and kidneys. GLP-1 agonists, they can lead to serious weight loss and also protect your heart. And the newest kids on the block, the dual-action agents, well, they're taking both sugar and weight control to a whole new level.
So what this really means is that these newer therapies are setting a completely new standard of care. By hitting both blood sugar and weight with such incredible effectiveness, they're tackling two of the biggest hurdles in diabetes all at once. It's a total paradigm shift away from just chasing that glucose number.
And that really brings us to the whole new philosophy in diabetes care today. The goalposts have moved. It's no longer good enough to just manage a number on a meter. The real goal now is to protect the entire body, the heart, the kidneys, you name it. And at the end of the day, to truly improve a person's overall quality of life. So how do we actually do that? How do we make that happen? It's all about navigating this for the long haul. And look, this isn't about being scared. It's about being empowered. Being proactive is, without a doubt, the single most important thing for living a long, healthy life with diabetes. In fact, let's stop using the word complications. Let's reframe that. Good management is a shield. It's a shield that actively protects your body's most critical systems: your heart and blood vessels, your kidneys, your eyes, your nerves. Consistent, proactive care keeps all of these systems strong for years to come. And being proactive isn't just one single thing, right? It's a combination of all these consistent efforts working together. We're talking regular checkups with your doctor, keeping an eye on your glucose, sticking to your medication plan, maintaining that healthy lifestyle, and, yeah, even managing stress. Every one of these pillars supports the others.
So let's wrap this up by looking forward, because the road ahead is genuinely exciting. The pace of innovation in diabetes care right now is faster than it has ever been in history, and it's pointing toward a future that is just full of hope.
I mean, just look at this trajectory. Today, these smart insulin systems are becoming the standard. In the very near future, we are looking at immunotherapies, drugs that can hopefully tell the immune system, hey, stand down, stop that attack, in type 1 diabetes. And then, further out on the horizon, scientists are working on ways to actually regenerate the very cells that were lost. We're talking about a potential functional cure.
So you see what's happening, right? The entire mindset is shifting. We're moving from just playing defense, managing a condition, to going on offense. The goal now is to preserve function, to prevent damage before it even has a chance to start, and to actively chase down ways to restore what was lost.
And that leaves me with this one final big question for you to think about. When we have therapies that do so much more than just lower a sugar number, when they can protect your heart, help you lose weight, and save your kidneys, are we on the verge of completely redefining what it means to live with a chronic illness? Maybe we're moving from an era of just managing decline to an era of actual restoration. It's an incredibly hopeful thought. Thanks so much for watching.